Hi, I'm Jennifer. Today I'm going to be talking to the research facility and asking some questions. Let's find out.
Hi Jenny, I'm Stuart.
So what is research?
Research is really about thinking of a question you don't know the answer to and then conducting some investigations to answer that question as best you can. And through that process you can hopefully generate information which will then lead on to conclusions that will improve our understanding. This could be testing a new treatment against a treatment that we use already to see which one is better, but there are lots of other ways too.
So if I wanted to find out which were better, oranges or apples, I could do a taste test and that would be research.
Exactly. It all depends on the type of research because each project is different and therefore uses different approaches. So some of the approaches and studies that we've got look and follow patients over time. Others might involve questionnaires or even attending a focus group. Some of our projects also involve coming to the hospital more frequently for tests or measurements.
And it's completely safe?
All research has to be approved by a Research Ethics Committee, whose role is to ensure that the safety, the rights and the well-being of participants is maintained at all times. They ensure that the information that we provide to participants is accurate and all the risks are explained. It's also important to us that we put the safety of our patients and their families first. Would you like a cup of tea?
Yes, please. Shall we see who's behind the orange door? Excuse me, do you know why we do research?
Oh, hi Jenny. Yeah, actually I do. We always want to give the very best care possible, and carrying out research helps us to improve treatments and create better outcomes for patients with specific diseases. The research we conduct here is recognised all around the world. It also helps us to find solutions to problems related to other conditions with the hope of giving children and their families a better future.
Is it helpful if I take part in research?
Yes, very. Taking part can not only improve your understanding of a condition that you or someone close to you may be going through, but you will also be helping others who may be suffering from similar diseases. Diseases can affect people of different ages differently, so by taking part you will be representing people of your age group. The research that we conduct here is funded in a few ways. It might come from charitable trusts like the Children's Hospital Charity, or government grants, or it might come from different pharmaceutical companies.
Ah, thank you. Is there anyone around here that could tell me more?
I think so, yeah. Why don't you try next door? Would you like a push down the corridor?
No thanks, I've got it. Bye. Hi.
Hi Jenny, how can I help you?
Actually, I was thinking about school. Will I need to miss it to take part in studies?
Well, that depends what sort of trial that you're on. Sometimes the visits might be in the morning and you might come to us and then go to school in the afternoon, and other times it might be in the afternoon that you come and see us, so you could be at school in the morning.
And what happens to the things I tell you during the research?
Well, all the information you give us is kept confidential. Things like your name and address, we wouldn't tell anybody, but we do put a little note in your medical notes, and it's only the study team that will know that you're on that trial. If you change your mind and you don't want to be on the trial anymore, that's fine as well. Nothing will change about your care at Sheffield Children's Hospital.
I've got one more question.
What's that?
Have you ever done research to see which is faster, a gorilla or a shark?
Oh, it might depend whether they're in water.
Or if the shark has a bite?
Tricky.
True, I might have to do some research on that. Bye!
Bye!
I hope you all learned something new. If you want to find out more, please read this! Bye bye!